The EzDent-i Chapter 4 Console tab, the Video Treatment Library. The objectives of this session will be able to review the category selections, whether it be implant, endodontics, etc., as well as choosing a subcategory selection such as developmental disease and implants. We'll start from the Console tab and navigate to the bottom left-hand side under Category, where our videos are separated by specialty such as conservative dentistry, prosthodontics, periodontics, implant dentistry, oral surgery, pedodontics, oral medicine, as well as orthodontics. Under each specialty, we have a subcategory of videos, such as this case here, conservative dentistry for root canal treatment, restorative treatment, surgical abrasion, tooth whitening, and development of disease. For prosthodontics, we have inlay, crown, bridge, laminate and veneers, denture, Maryland bridge, and vertical dimension. Under periodontics, we have saline and curate, periodontal surgery, periodontal disease, as well as flap. Implant dentistry, we have implant category, maxillary sinus lift category, as well as implant over denture. Oral surgery, we have extraction, as well as others. Pedodontics, we have treatment of primary teeth, as well as others. Oral medicine, we have TMJ and Botox as options. And lastly, under orthodontics, we have orthodontic diagnosis, surgery, treatment, and removal. We'll now go through each one of these categories, starting with our conservative dentistry, looking at our root canal treatment option, and then from there choose a subcategory. So starting with the root canal treatment, we'll then look at the various videos associated with that. To be able to choose your video for the root canal treatment, simply navigate to the bottom right hand corner, use the slide bar to choose the appropriate video, and either left click and drag or double click to view the image or video in the viewing screen area itself. You can then left click and drag another video to watch two videos simultaneously or watch them back to back. Under root canal, we also can go to a subcategory as well for restorative treatment, where we can look at doing a root canal itself. Left click and drag the video in place in the left hand pane as well as in the right hand pane to view them again either simultaneously or conjunctively. We can then navigate down to cervical abrasion, choose the appropriate video, left click and drag into place to watch either simultaneously or individually as well. And you can also click and drag images to bring in there, do a side-by-side comparison. Under tooth whitening, we can left click and bring up the video for that as well, and bring up an image that would relate to a intraoral image, and do a comparison as far as doing a teeth whitening procedure. And we can fast forward through the video as well to be able to look at highlights from that and then be able to compare such as before and after. For development of disease, there's a video related to that also, how the disease can affect the arch and how the disease can spread from one tooth to another. So we click on the play button to be able to play the video and be able to use it as a consultation type of video. Moving on to prosthodontics, we're again looking at doing an inlay. We can left click and drag our image into place or video, view again side by side at the same time or back to back. Moving on down to the next category, such as crown, left click, drag a video up in place, related to placing a crown. Left click on crown, go to the next category such as doing a bridge. Left click and drag our video into place there for doing a multi-unit bridge. And again showing it either simultaneously or showing them back to back. Next category under prosthodontics would then be our crown or laminate, which again we can then show side by side. We're doing a treatment based on tooth yellowing. Going to dentures, to left click and drag the video there for doing a denture, such as doing an extraction first before doing a denture. Doing a Maryland bridge, to left click and drag the video in place. In this case here, watching two videos simultaneously again. And then going to the last category under vertical dimension, where we can then look at facial height differences based on performing a denture procedure. Again, showing before and after, either concurrently as well as doing back-to-back video presentations. Moving down to periodontics, we then look at scaling and curate. Again, bring up videos side by side, to watch them either individually, concurrently, or watching them back to back. Going down to periodontal surgery, we can left click and again drag the video into place. We can pause our video while watching the first video. Moving on to the next one, looking at periodontal disease. Left click, drag the video into place for that as well. And the video will play automatically. Left click and drag into the second window, again to either watch concurrently or watching these videos back to back. Moving down to the last category of flap under periodontics, left click and drag the video into place. Moving on then from implant dentistry, looking at doing perhaps a maxillary sinus lift, we can left click and drag the video in place to show how we would do the procedure for a sinus lift augmentation. Again, showing either concurrently or back-to-back videos, as well as looking at doing an implant overlay or redenture. Again, left clicking to play the video to pause it and be able to watch this videos side by side or watching them concurrently, as well as watching these videos back to back. Moving on to the next category, we can go down to into oral surgery, looking at doing extraction. Left click, drop the video in place in the left hand pane. Going down to the next category under other, we'll look at doing a bridge or a dry socket tooth replacement. Moving on to pedodontics, we're going to look at doing perhaps a root canal on a primary tooth that is over a deciduous tooth. Or go to others, relating to disease of a tooth or extraction of a tooth. Moving on to the next category under oral medicine, under TMJ disease, we can left click and drop that in place, looking at the relationship of the condyle and the fossa. Looking at Botox, left click and dragging video into place there as well. Show before and after as far as doing Botox injections. Moving on to orthodontics, where we now have the ability to show facial videos of morphing showing either class 1, class 2, or even class 3 type patients. Moving on to orthodontic surgery, to show how a joint would either be advanced or protruded, depending on whether being class 2 or class 3. Also showing orthodontic treatments, such as using brackets, and showing how the jaw would perhaps be expanded to accommodate crowded teeth. And then last, looking at orthodontic treatment itself as far as removal, such as headgear. In this next example, we'll do a real-life demonstration using an image such as this perio and bone loss, and then find a video which will help explain the disease that caused the bone loss itself underneath our conservative dentistry as well as root canal treatment, and then from there pick the appropriate video. We can left click and then again drag the video into place to help explain the cause of this infection and then what the treatment would be in order to correct it. You can fast forward to highlight as well, and you can also then use a different video here as well to help explain how a disease in one tooth can spread to another tooth and affect multiple teeth. And then lastly, also show the ability to do perhaps an implant. We can then choose our implant dentistry category, choose the implant video category, and then from there left click and then drag the video that we want to view as it relates to doing the treatment of our patient. So in this case here, we can show multiple treatment plans for the same image showing the cause of the disease within the bone itself due to the fractured tooth that created a condition the tooth cannot be salvaged. In summary, you should now be able to choose a category based on specialty such as implant or endodontics, as well as a subcategory such as development disease as well as implants.